In Module 4, we discussed using frameworks to help us identify learning needs and create learning opportunities. In this segment, we'll talk about applying these same tools to some of the peer learning approaches that we just learned about in our previous segment. So the question is, what frameworks can we use to guide peer coaching, peer tutoring, teaching, or assessment, peer observation, case presentations, patient handoffs, and daily or weekly reflections? Well, let's see what we have available. During peer coaching or tutoring, we can use simple competency checklists to guide the process. These checklists might come straight from something like the CPI, or they might be created collaboratively by students and the CI to meet local needs. Here are a couple of examples. In the CPI category, procedural interventions, the first key behaviors listed are safety, effectiveness, efficiency, fluidity, coordination, and technical competency. This list would give you a broad view of performance and lots of leeway to make qualitative comments. Other CPI sample behaviors in this category that could be used in a checklist include performing consistent with the plan of care, using alternative strategies, providing rationale, adjusting intervention appropriately, and incorporating self-efficacy in patient education. But maybe you have some specific task competencies in your clinic that you want to assess. Sit down with your students and talk about the key components of each task and use those components to create a simple competency checklist. Now everyone will be on the same page. During peer observation, students often find it helpful to use a framework as well. Alpine and colleagues created a peer scripting and observation checklist for this purpose. We have included an adapted version as a PDF in this module for your review, but here are the key components. The checklist cues the student to comment on their partner's preparation for the encounter, the way they establish rapport, how they use listening and questioning to gather information, how they perform objective procedures, and how they wrap up the encounter. Your students might find this checklist or one of your own making useful in guiding their scripting and feedback when they're observing each other. Take a moment to pause the video, open and review the checklist in your module, and think about how you might apply this idea with your own students. We already discussed using the SNAPS framework and the 1-minute preceptor as methods of providing feedback and identifying learning needs, but these tools are also valuable instruments for training students how to systematically approach the presentation of a case to a peer, a doctor, or their instructor. Just to review, the 1-minute preceptor is a quick way to assess knowledge by having the student make a decision, provide rationale and evidence, and then discuss their choices. This can be done with the clinical instructor, but it's also a great way for students to learn from each other. And if you remember in the SNAPS model, the students prepare and present cases by summarizing the history, narrowing the diagnosis, analyzing solutions, asking for ideas, planning solutions, and studying related topics. In our PT/PTA student team, we can have our students collaboratively prepare and present cases using the same SNAPS framework. Doing this as a team will encourage peer learning and give us an opportunity to foster positive team dynamics. Similarly, when our students are sharing patient information with each other, we can have them practice using a tool like SBAR to guide their thought process and train them to be precise and thorough. They'll quickly form a good habit and rely less on the tool as they progress. And finally, you can improve the quality of your end-of-week or end-of-day reflection sessions by using a framework like the Self-Directed Learning and Reflection worksheet that we introduced in the Reflection segment. Using this or a similar tool will help your students learn to regularly ask themselves probing questions about their own performance that will lead to more specific goals and enhanced clinical skills. In summary, there are a lot of tools available to help guide our peer learning activities, such as the CPI, the peer scripting checklist, SNAPS and SBAR, the 1-minute preceptor, and a reflection worksheet. Choose what works best for your team or create your own. Thanks for listening. Here are the references that we used for this segment. Please take a moment to jot down some of your ideas for using frameworks to facilitate peer learning with your next student team.